Hello students and welcome to today's lecture. Our today's topic is status of mental health in India. And the objectives set for today's lecture are to know about the meaning of mental health, to get acquainted with various definitions of mental health, to have a brief look over the mental health in India, to know about the current status of mental health in India, to get aware about the different barriers to mental health care in India, to point out the different suggestions for improving mental health care in India. Let us introduce first. Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and fruitfully, and is able to make contribution to his or her community. In this positive sense, mental health is the foundation for well-being and an effective functioning for an individual and for a community. Mental health also refers to cognitive, behavioral and emotional well-being. It is all about how people think, feel and behave. Mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living and enjoy life. On this basis, the promotion, protection and restoration of mental health can be regarded as a vital concern of individuals, communities and societies throughout the world. Thus, mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps determine how we handle stress, relate to others and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood and aging. Mental health plays a crucial role in development of personality, but there are many factors which help in developing positive and negative development of mental health, like heredity, attitudes and behavioral patterns, abuse, separation from loved ones, etc. Mental health is not a state of exclusion, and the purpose of promoting mental health is not same as treating mental illness. The presence of mental illness implies the absence of mental health, but the absence of mental illness does not imply the presence of mental health. Mental illness is the instability of one's health, which includes changes in emotion, thinking and behavior. While mental health is being socially, cognitively and emotionally healthy. We need to create more awareness about mental health to help people understand mental illness and mental health are different. This way, we can understand the separate implications of mental health and mental illness without any confusion, misconception and miscommunication, and ultimately reduce their stigma attached to mental illness. Now, what is the meaning of mental health? The concept of mental health is as old as human evolution. Our ancient scriptures are full of references to mental diseases, but this concept is comparatively new. Mental health emphasizes the importance of integration of wholeness of personality. A mentally healthy person is one who has a balanced personality, free from schism and inconsistencies, emotional and nervous tensions, discords and conflicts as well. Adjusted person can deal with his potentialities as well as he can accept limitations. Generally, a person who likes himself may be regarded as mentally healthy. Conversely, strong dislikes of oneself is a typical symptom of maladjustment. A mentally healthy individual feels that he is an accepted member of a social group and they in turn liked by him. But the maladjusted person may react in totally different ways. Now, different definitions of mental health. It is a normal state of well-being, and in the words of Jones, Sutton and Webster, it is a positive but relative quality of life. It is a condition which is characteristic of the average person who meets the demands of life on the basis of his own capacities and limitations. By the word relative, we imply that the degree of mental health which an individual enjoys at a time is continuously changing. According to Hardfield, mental health is the full and harmonious functioning of the whole personality. According to P.V. Levcon, mentally healthy individual is one who is himself satisfied, lives peacefully with his neighbors, become healthy citizen of the country, and even after performing these fundamental duties has enough energy left to do something of benefit to society. According to K.A. Manager, mental health refers to adjustment of human beings to the world and each other with a maximum of effectiveness and happiness. It is an ability to maintain an even temper, an alert intelligence, socially considerate behavior and happy disposition. Last but not least, according to World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Thus, it implies the capacity of an individual to form harmonious relations with others and to participate in or contribute constructively to change in his or her physical and social environment. Moreover, it is not a static entity. Rather, it is a dynamic and subject to variations and fluctuations. In its positive sense, mental health is the foundation for well-being and effective functioning for an individual and for a community. Now, let's have a look over the mental health in India. Mental health in India is still a fairly new topic, and the mental health myths and taboos attached to this subject are prevalent to this date. Statistics shows that 1 in every 5 individuals suffer from some form of mental health illness symptoms. 50% of mental health conditions begin by age 14 and 75% of mental health conditions develop by age 24. Mental illness can be triggered by multiple factors. Complex interactions between mind, body and environment result in psychological disorders. Some of the factors are long-term acute stress, biological factors, drug abuse and overdose. Cognitive behavior like constant negative thoughts, low on energy, etc. Social problems like financial problems, breakdowns, isolation, etc. According to National Health Program by the Ministry of Health and Family Welfare, 6% of Kerala's population has mental disorders. 1 in 5 has some emotional and behavioral problems. Close to 60 to 70 million people in the country suffer from common and severe mental disorders. India is the world's suicide capital with over 2.6 lakh cases of suicide in a year. WHO statistics say the average suicide rate in India is 10.9 for every lakh people. India also accounts for 36.6% of suicides globally. and that suicide has surpassed maternal mortality as the leading cause of death among women and teenage girls aged 15 to 19 years. Lancet study suggests that India's contribution to global suicide deaths increased from 25.3% in 1990 to 36.6% in 2016 among women, and from 18.7% to 24.3% among men. As per the National Mental Health Survey 2015 to 16 conducted by the National Institute of Mental Health and Neurosciences, Bengaluru, under the purview of Union Ministry of Health and Family Welfare, it was revealed that 9.8 million teenagers in the age group of 13 to 17 years suffer depression and other mental health disorders and are in need of active intervention. Whereas according to a study by the Lancet, suicide deaths ranked first among all causes of death in women aged 15 to 29 years in 26 of the 31 states, and in women aged 15 to 39 years in 24 states in the country. WHO also estimates that about 7.5% Indians suffer from some mental disorders and predicted that by end of 2020, roughly 20% of India will suffer from mental illnesses. According to the numbers, 56 million Indians suffer from depression and another 38 million Indians suffer from anxiety disorders. Now, status of mental health in India. The majority of people in India perceive health as physical health, and to be in good health is seen as being free from any disease that has outward biological manifestations. The report, according to Lancet Psychiatry 2020, reveals that in 2017, 1 among every 7 people in India has a mental disorder, ranging from mild to severe. The proportional contribution of mental disorders to the total disease burden in India almost doubled from 1990 to 2017. World Health Organization has labeled India as the world's most depressing country. Moreover, between 1990 to 2017, 1 in 7 people from India have suffered from mental illness, ranging from depression, anxiety to severe conditions such as schizophrenia, according to a study. Mental health is an issue in India due to various reasons. These reasons are: Number 1, mental health can be considered as a neglected area in the Indian society as well as many other parts of the world. Not many doctors or healthcare professionals are available in this area. Depressed patients, on admitting their depression levels, are looked down upon and treated as lost minds or mentally sick. There are chances for them to be cut off from the society, which become the reason they never come out to accept their medical condition. As per WHO in India, the number of patients of mental health has crossed 13 crores, with only 4,000 doctors to manage them. The gap is thus very wide. Mental health is not discussed as such patients are prone to physical and social abuse in any part of the society. Mental health care providers' availability is globally one of the lowest as per population basis. In India, there were 3 psychiatrists per 10 lakh population and around 5 psychologists per 1 crore population in 2011. This makes availability of professionals limited to most demanding and high-paying locations, leaving rest of the locations unserved. With more than 50% of its population still dwelling in villages, there is acute shortage of basic health care, mental health care services and facilities. On the other hand, mental health care providers are overworked. This was all about status of mental health in India. Now, let's have a look over the barriers of mental health care in India. Mental health and well-being are by far one of the most neglected areas in our country. According to a recent National Mental Health Survey, approximately 150 million people in India need care for their mental health condition. The same survey also discovered that between 70 and 92% of these cases fail to pursue treatment. The World Health Organization says India has the highest number of teenage suicide rates globally. It is also to be noted that 1/3 of India's population, means more than 11 billion, continues to live below the poverty line. A large percentage of these 11 billion people live in absolute poverty, in need of food, shelter and without any source of income. Poor awareness about the symptoms of mental illness, stigma, and the lack of mental health services available has resulted in a massive treatment gap, with inadequate number of trained mental health care professionals. Common barriers to mental health care access include limited availability and affordability of mental health care services, insufficient mental health care policies, lack of education about mental illness and stigma. They can be discussed as: first, cost. In India, the high cost of psychiatric treatment, often due to high medication prices, poses significant financial barriers to patient care. In addition, psychological disorders are not covered by insurance policies in India, making mental health care unaffordable for many people. The WHO also reports that 25% of all countries do not provide disability benefits to patients with mental disorders, and 1/3 of the world's population lives in countries that allocate less than 1% of their health budget to mental health. Furthermore, 31% of countries do not have a specific public budget for mental health. Next is social stigma. People experiencing psychological distress struggle to access help from others. Due to stigma and negative perceptions surrounding mental health, and help-seeking people are reluctant to approach others for help. Stigma associated with mental illness often prevents patients from seeking and adhering to treatment, as patients may attempt to distance themselves from the labels that mark them for social exclusion. Stigma is in our country often leads to discrimination or the inequitable treatment of individuals, and the denial of rights and responsibilities that accompany full citizenship. Stigma prevents mentally ill individuals from seeking treatment, adhering to treatment regimes, finding employment, and living successfully in community settings. Social stigma is doing more than just keeping some patients away from the mental health clinic. It is also obstructing societal awareness about mental health and making it more difficult to know about the healthcare industry. In India, cultural and religious teachings often influence beliefs about the origin and nature of mental illness and shape attitudes towards the mentally ill. In addition to influencing whether mentally ill individuals experience social stigma, beliefs about mental illness affects patients' readiness and willingness to seek and adhere to treatment. Next is lack of personnel in the field. Unavailability of essential medicines is particularly prevalent in developing countries and severely restricts access to treatment for psychological disorders. The World Health Organization reports that nearly 20% of countries do not have at least one common antidepressant, one antipsychotic and one anti-epileptic medication available in primary care settings. This problem is compounded by a lack of mental health care professionals in low and middle income countries. Low income countries have a median of 0.05 psychiatrists and 0.16 psychiatric nurses per 1 lakh people. Even fewer resources are available for children and adolescents. The WHO reports that most low and middle income countries have only one child psychiatrist for every 1 to 4 million people in 2005. Community-based mental health care is also rare in low-income countries. About 52% of low-income countries offer community-based mental health care programs, compared to about 97% of high-income countries. Next is education and awareness. In our country, limited knowledge about mental illness can prevent individuals from recognizing mental illness and seeking treatment. Poor understanding of mental illness also impairs families' ability to provide adequate care for mentally ill relatives. People sometimes avoid seeking help for mental illness for fear of being stigmatized and discriminated against. And in some cases, misconceptions about mental health disorders make this concern even worse. Misinformation of mental disorders is rampant in the remote corners of the country, from where perpetuates a vicious cycle of stigmatized behavior towards mental health. Due to lack of access to better care and facilities, patients mostly are unaware of the mental disorders they are suffering from. Next is lack of policies. Lack of comprehensive mental health policies in our country is a key barrier to public access to mental health care. Mental health care policies have not been revised and do not address recent in mental health care. In India, mental health care system is seriously underdeveloped. Yet mental health problems not only have huge consequences for quality of life, but contribute to economic burden and reinforce poverty. There is also poor coordination between policy and practice and lack of cooperation between organizations and professionals at different levels of mental health services. Lack of information on factors relating to health care or the inability to use such information creates cognitive barriers. Now, how we can improve mental health care in India? The first and the foremost reason for India to lose its mental health is the lack of awareness and sensitivity about the issue. The allocated healthcare budget and the prevalent social stigma around it have emerged as two major problem areas. The various suggestions for improving mental health care are: the present mental health situation in India requires dynamic policy and resource allocation by the government. There is urgent need to use media and social media and other community services to increase awareness and to reduce the stigma around mental health illness by implementing national-wide programs. In addressing mental health care concerns, the government needs to recognize the roles of counselors and psychologists besides psychiatrists, and the fact that not every person diagnosed with mental illness needs institutionalization, since mental health diseases constitute up to 13% of the total health burden. The central government needs to allocate a large chunk of budget to incur the expenditure in providing adequate medical infrastructure at district and sub-district levels and to reduce the burden of the state governments. Many experts are of the opinion that National Commission on Mental Health, comprising professionals from mental health, public health, social sciences and judiciary, and related backgrounds should be constituted to oversee, support, facilitate, monitor and review mental health policies. Changing attitude towards mental illness, it must not be looked as a biomedical problem, but also as a social concern, with a healthier and a human right perspective to deal with mental health issues. Conducting projects and activities with adolescents and youth, parents and general physicians to give a fillip to the initiative of tackling stigma and discrimination. On an individual level, it is important for people to develop empathy and to be open to listening to their suffering family, friends or peers non-judgmentally. The small actions on an individual level will be responsible for creating big rips of change as a society. There must be more educational opportunities available to future mental health care professionals such as psychiatrists, psychologists, counselors, social workers and psychiatric nurses. Some proportion of funding from the government should be diverted towards creating more educational programs for these courses. Furthermore, the compensation allocated to these professionals should be regulated and standardized, so as to remove barriers from interested individuals joining this field. Thus, there needs to be a multi-pronged approach to improving the status of mental health in India. All the state and non-state actors along with the individuals need to make concerted efforts towards this humanitarian goal. Now, dear students, let us conclude. The condition of mental health institutions in India is extremely poor. Mental health forms an integral part of the overall health and well-being of people. Mental health is influenced by a number of social, cultural, political, economic and environmental factors such as national policies, living standards, working conditions and community support. Treatment and cure for mental illness is of utmost importance, and ignoring them can escalate the issue pretty exponentially. Unfortunately, mental health in India has never been given any importance or attention at all. To reduce the stigma around mental health, we need measures to train and sensitize the community or society. This can happen only when we have persistent national-wide effort to educate the society about mental diseases. We also need steps to connect the patients with each other by forming a peer network so that they could listen and support each other. Moreover, people experiencing mental health problems should get the same access to safe and effective care as those with physical health problems. Additionally, mental illness must mandatorily be put under the ambit of life insurance. This will help people to see mental illness with the same lens as they use for physical diseases. Dear students, this was all about the status of mental health in India. Hope you enjoyed the lecture. Thank you.